Hello, welcome back to Mary's Virtual Healthatorium. Today we're going to be talking about partner head, neck, and face massage. And you can actually do these techniques on yourself. It's just easier and more effective and more relaxing and fun if you have someone do this for you or you do it for somebody else. And of course, every time I try to there's my transition. Okay, so the way we start a head, neck, face massage is you have your partner in supine, meaning they're laying on their back facing up. And you are the practitioner and you're sitting at the head of a massage table like this, or you could be down on the floor, or you could be on your bed. So you're kind of kneeling in these situations, or like in this situation, which is the more effective way, as you can see, you're sitting at the head of a massage table. Like I said, a bed works as well. You can take a chair right up to the foot of the bed and you could do it that way. So your partner is in supine. You have them take a very deep inhale, and as they do, you're going to slide your hands under their back with the palms up. And once you get to about mid back, curl your fingers up and just hold your person there. Hold your fingers there. Have them take a few deep breaths. And then on one of their exhales, rake your fingers up toward the base of the skull. Do this slowly and deliberately. And if you're doing this, make sure that your nails are a little bit shorter so that you're not gouging your partner's back. And then once you get up to the base of the skull, you're just going to hold your fingers there. So you're going to feel a bone, like a bony ridge at the base of the skull. This is called the occipital ridge. And there's a lot of muscles right along this ridge. So the muscles that allow you to nod your head yes or shake your head no. Those are the muscles you're holding. There's also very important pressure points located at this part of the skull or the scalp that is attached to this part of the skull. And these are very relieving if somebody has headaches, if they're feeling dizzy, if they're feeling anxious. This is a really good place to hold them. As you can see in this photo, um, I've got my little pointer here. Notice how the practitioner's fingers are curled up. That's how you're holding the occipital ridge. And you can like stay here for a while because this is very relaxing. And you're actually giving the neck, let me point out the neck here, you're actually giving the neck a gentle traction. So this is a really important technique. And you want to hang out here for a while, okay? If you and your partner are more verbal, you can tell them to inhale, take a nice big inhale, take a slow, deep exhale. You can talk through the breath here, or you can be completely silent, or you can have a little bit of music playing in the background. So I wanted to show you these charts before you get into your head, neck, and face massage. These acupressure points are very important. And a lot of these we find in traditional Chinese medicine. Um, However, even in Western medicine, um, they recognize these points because they happen to follow certain blood vessel lines. So even Western medicine recognizes these points. And you can see at the top of the head, and remember that the scalp, underneath the scalp, it's all muscle. And like any other muscle in your body, these muscles get tense. So some of them are really good acupoints. So you're taking your finger and you're just pressing down on any one of these points. For example, here's the one for dizziness. You're just going to press down on that point. Nasal obstruction, more toward the frontal lobe, or the frontalis is the name of the muscle. And then over here we see a scalp reflexology chart. And a lot of these points, according to Chinese medicine, are directly linked to other parts of your body. So there's this word called homunculus. It is a Latin word meaning little man. Um, but in the scalp reflexology chart, you see an example of homunculus. For example, here's a pressure point that has to do with your heart, right next to that spinal cord. Or if you go over here, if you have hip issues, you go right above the ear and you press on these points. So take a look at this chart, and maybe if you have a low backache or a stomach ache, go to these points and maybe you're include them in your massage and focus on those points. You don't have to, but it's a really good thing to do. And after you've done your little pressure points with your fingertip, like the pads of your fingers, um, gentle hair pulling is really relaxing. And it's not only relaxing to the mind, but it's relaxing to the muscles of the head. So with short hair, you just go right at the root and you're not yanking the hair, you're just grabbing onto it and very gently pulling it. And you can do this for long hair too. So again, I would do the same technique, kind of grab toward the root of the hair and then do a little gentle but firm tug. Do not yank. Um, when you're doing a head, neck, face massage, you want these to be gentle little tugs. Then you can just go freestyle. So now you're rubbing the skull, you're raking your fingers across the skull. You might do little circular motions with the pads of your fingertips. What I would suggest you do is set your fingertips on the skull and then engage. Once you get your fingertips on the skull, kind of dig in deeper and then move very deliberately without disengaging that depth. So you want things to be done slowly and deliberately, and check in with your partner. If something hurts, if you're squeezing too tight, they can let you know. Or if it feels more like nail scratching, they can let you know this. Always work with the pads of your fingers, unless you're on a acupoint, then maybe you can be a little more deliberate and pointed with the top of your finger. Again, it doesn't work very well with long fingernails, although in some ways that can be relaxing too, depending on the technique you're using. So, another technique with scalp massage is the froggy fingers. So, you have your fingers just like you see here. Okay. You have your fingers on your partner's skull. Then you bend your knuckles and then you straighten the knuckles. So you're doing like frog legs, how they bend them and then straighten them. Or another way to do that is you're moving the actual pads of the fingers. So you're starting in one spot, and then as you pull up, your fingers come together, and then you go back out so that your fingers are splayed like this. And then as you pull up again, the fingers come together. So those are froggy fingers. Make sure you cover the entire skull because Again, it's all muscle and it all gets tense. Get the back of the head, the top of the head, the sides. Okay. Once you're done with the skull, and take your time here, don't rush through it. You want to be here maybe 10 minutes. It feels really good. Then you come up to the forehead. And as you see in this photo, the fingers are just laying across the forehead. And you can start at this position. What she's doing here that you can't really see is she's really engaging her fingertip or the pads of her fingers into the brow. And she's doing an isometric pull. The word isometric means it's not a dynamic move. You're still, but you're deeply engaged and you're pulling without moving. You're pulling the brow up toward you as the practitioner. So you're giving her a nice stretch in the brow area. And it's very relaxing. From here, you can take the pad of your palm and glide, like start in the middle of her forehead and then glide off to the right, go back to the middle of the forehead, glide off to the left. Again, you're deeply engaged before you move. So engage first, make sure it doesn't hurt, and then glide. Or with the fingers in this position that you see here, you can do like a light typing type of technique. So pretend like you're typing on your computer, but do it lightly. The taps are very relaxing. So that's how you do forehead techniques. And then as you're doing this and you feel inspired to do some other sort of technique, like you could take your the pads of your fingers to the inner brow so that you're touching both of the inner brows, engage, and then again pull up. Those are very important acupressure points. So get creative with this. Once you're done with the forehead, and you can see in this first picture the gentle sweeping motions, you could do that with fingers. You can even do it with the palm of your hand. Then move down toward the cheeks. So I think I have my bar kind of obstructing some of the words here, but let me see if I can remove this. I'll move this up here. So you're going to feel a bony ridge in each cheek. Go right underneath that bony ridge and then sweep your fingers upward toward the ears. Use sweeping strokes. This is incredible if your partner has a sinus issue, if they have sinusitis, if they have allergies, that sweeping motion can actually open up lymphatic channels that will help them drain. It's really amazing how well it works. So you could do that. And then this V technique for the eyes, where her finger pads are. Again, she's touching four at the same time acupressure points. Two are in the medial or in the inner eyebrow, and then two of the points are at the outer edge of the eyebrow. So again, she's engaging and she might just stay here engaged, or she can start to push up. And again, it's kind of an isometric movement. You're hardly moving at all, but she's getting a nice stretch in the orbital region, which is what the eyes are. And then see the jawline and the neck downward strokes. Be extremely careful here. Okay. So this is almost like a very gentle, like you're almost tickling. You want the pressure to be no more than like if a penny was laying on the skin. just very light pressure. And the reason for that is this is where a bunch of veins are. So you have your vertebral um, blood vessels that go straight up to the brain. You have your carotid arteries. You have your jugular veins. You don't want to cut off the blood supply. So don't choke your partner out. Not during this technique, anyway. Just very gentle strokes. Okay, like you're caressing them lovingly, lightly. Okay, that's very relaxing. Okay, let's advance. What are we advancing? Hold on, I'm going to move my stuff back down here. And okay. Well. Let me escape out of this, and then we'll come down here. Okay. Uh, so the ear massage. Okay. You're not letting me go. Okay. Here, I'm going to just kind of advance through. Bear with me, folks. Okay. Here we are. The ear massage. So again, that homunculus I talked to you about, how that chart that showed the scalp, how you saw like pressure points for the heart and the lungs and all the other organs of the body, that also lives, if you will, in your ear. So the ears have many pressure points. Okay, so play with the ears. So gently tug on the earlobes. I like to see where his fingers are on her earlobes. So he's touching it from, he's kind of pinching it. So you want to give him a gentle pinch and then kind of drag them down toward the table and maybe even out a little bit. And like her whole ear will kind of open up. So the auditory meatus, which is the whole of the ear, is getting stretched when you do that. So right here. And it feels really good. And then just very gently just stroke all around the ear and be careful because once you get to the top part of the ear, it's a lot of cartilage and not so relaxing, whereas the lobe of the ear is fleshy. But you can just very gently pinch along the upper part of the ear because that's where all of those pressure points are. But again, go easy because that's all cartilage and going deep doesn't feel good. And then finally, to end your massage, what I often do is I ask my partner to inhale. And then once again, just like I started, I take my hands and I put them under their back. So I go to the about mid back with my palms up. I have them take a couple breaths, and then on their next exhale, then again, I pull my hands back up their back, up the neck, and then I land in this position you see here where I'm just cradling the head. Sometimes I have my fingers curled under to once again give that occipital ridge another isometric pull or traction or acupressure point techniques. But sometimes I don't do that. And even if I do, I at some point release my fingers down. So I'm just cradling the head. And this is very nurturing. It's very relaxing. And your partner will love it. So I hope you give this a try soon. Show your partner how to do it, and they should return the favor. So have a good time, and I will talk to you next time. Bye.